Good morning, everyone. Thank you for joining us today. I'm Ann Mazer, CEO at EveryMind. I'm excited to announce that we have 200 people on this webinar this morning. In addition, we're streaming live on Facebook and we'll have community members joining us on Facebook. I would like to first recognize funders who specifically support EveryMind's Serving Together program: Agua Fund, Boeing, CSX, the Morris and Gwendolyn K. Fritz Foundation, Montgomery County Government, Syracuse University's Institute for Veterans and Military Families, Unite Us, the Harriet and Jeanette Weinberg Foundation, and Wells Fargo. Just wanted to go over a few housekeeping items before we get started. Attendees will not be on camera or heard during the event. However, I encourage you to submit questions throughout the webinar. There is a Q&A feature to submit questions on Zoom and also in the chat on Facebook live stream. Resources will be shared throughout the briefing via chat. Today's briefing is being recorded and will be sent to you after the event. In addition, I invite everyone to follow us on Facebook and Twitter at EveryMind Inc., where you can share this event and engage with us ongoing. Before we get started, I wanted to just take a few moments to recognize the lives lost during the pandemic, lives lost to suicide, to illness, and just take a few moments for us to memorialize that before we get started this morning. Thank you. For those of you not familiar with EveryMind, I just wanted to give a very brief overview before we get started. EveryMind's mission is to strengthen our community and to empower individuals to reach optimal mental wellness. Through our work, we're committed to the mental health and well-being of every member of our community. That includes youth, adults, families, as well as veterans, service members, and their families. The Serving Together program is celebrating our 10-year milestone this year. Serving Together provides education, information, and referrals and coordination of resources for veterans, service members, and their families throughout the National Capital Region. I also wanted to announce an exciting expansion to Serving Together. As we celebrate our 10-year milestone, we are also this year expanding our services to Baltimore County, Baltimore City, Anne Arundel, and Howard counties. This is in addition to our current work in the National Capital Region in Northern Virginia, DC, Montgomery County, Prince George's, and Southern Maryland. As we get started, I have the honor this morning of introducing our moderator, Ike Leggett. Ike served 3 consecutive terms as Montgomery County Executive from 2006 to 2018. In 2016, he served as president of the Maryland Association of Counties and president of the County Executives of America. Early in his career, Ike received his Juris Doctorate from Howard University Law School, and he went on to be a law professor and associate dean. Ike has received numerous awards and honors during his 32 years of public service. Among the most notable are the Distinguished Alumni Awards from both Howard University and Southern University, and the George Washington University's Fulbright Public Service Award. And in 2015, Ike was named a Washingtonian of the Year. Ike also served as a captain in the Army, during which he did a tour in Vietnam. Please join me in welcoming our esteemed guest, Ike Leggett.
Ike, you need to unmute. You're still muted, Ike.
We're here this morning to talk about the critical issue of suicide prevention, not just for veterans, but for their families as well. On January the 5th, more than a dozen bills improving access to services for veterans and their families were signed into law. Among them was Senate Bill 785, or the Commander John Scott Hannon Veterans Mental Health Care Improvement Act. I want you to think about a number here. That number is 17.6. That's the number of veterans that take their lives every day. 17.6. That's a huge number. Now, oftentimes people wonder why that number is so high. But let me give you just a personal story for myself, having served in Vietnam and having looked at and worked with veterans over the years. We ask an awful lot of our veterans, and they've given an awful lot. But the stress, the strain, the challenges to every veteran and the families is enormous. Following my tour of Vietnam, for example, I had a very difficult time accepting sound because the sound of war, the sound of helicopters, bombardments, constantly bothered me for a long period of time. That sound was something that I could not get out of my mind for a long period of time. When veterans return, oftentimes they do not return to a very receptive environment. Oftentimes their family struggles. They've served in places that they are not familiar with, a culture that is different, a language that is different. And then you add to that the multitude of other challenges that they face. You can see very well why that strain oftentimes will cause crucial difficulties for veterans. And as a result of that, we see the strain and struggle resulting into a number of suicides today. I've heard people oftentimes say to veterans, "Thank you for your service, welcome back." That sounds awfully nice, but the real thing that we should do is not just simply thank them, but to work with them. Work with organizations such as EveryMind to make certain that we can do everything possible to ensure that we reduce or eliminate that number I gave you of 17.6. We're here today to try to find ways in which to be helpful, to work with EveryMind and others at the local, state, and national level to ensure that that number is reduced or eliminated altogether. We're going to hear from two outstanding public servants in just a moment, Senator Tim Kaine and my own senator here at Maryland, Senator Chris Van Hollen. But before we do that, I think we should hear from someone who could bring this message home even greater for us. That is Roderick Williams, who's a Vietnam, Robert Williams, an Army Reserve veteran, about the challenges he has faced and how serving together has helped him in year 2020. Roderick?
My name is Roderick Williams, and I served 8 years with the Army Reserves. I wasn't deployed during my tenure because it was time of peace, right after the Gulf War and right before 9/11. Sadly, I kept hearing our federal grants mandated that veteran support services can only officially be accessed by veterans who served on active duty 120 days or more. Learning this, it became clear that even though I served 8 years in the Army Reserve and was honorably discharged, my veteran status had an asterisk next to it. Last year, I lost my job due to the COVID-19 pandemic. I used to be the manager overseeing the Virginia Technology Apprenticeship Program, a program designed to give fully paid technology apprenticeships to transitioning service members, veterans, and military spouses. Due to my unemployment, my ability to have money for rent, car note, car insurance, utilities, all became compromised. I sought to get back on my feet through various veteran outreach programs, but all of them put asterisk next to my veteran status. I was getting uncontrollably depressed, and things got even worse once my unemployment money expired. Serving together gave me the lifeline I needed and literally stopped me from going down a dark abyss I was headed. Christy Kennedy's team made sure I was connected to the essential resources needed, and I had weekly food delivered to me, and I was connected with an agency that helped me with my rent arrears and rent assistance therefore after. And most importantly, they helped me get my mental health and wellness together by connecting me with a therapist so I can talk things out. Serving together did not look at me differently because I was a reservist without any active duty time served. They saw me as an equal veteran, and they were there for me. I want to be very clear with the following words. If it wasn't for serving together, I would either be homeless or dead now. That's how far into despair I was heading. I got countless job rejection letters, and I got overlooked by various other veteran service organizations. The weight on my shoulder became unbearable. I'm a rare statistic in this country, a Black man with no criminal record, an MBA, and no various baby mama dramas. I come from a low-income, emotionally and physically abusive environment, and I did everything that society asked of me to make an honest living. In this country, you either need health insurance, you need health insurance if you get sick. That's a common fact. I correlate this to the Army Reserve, which is this nation's insurance for our country's security. Like all insurance, you can go months or years without ever using it, but once you need it, it's better to have it than have not. I'm a part of this country's insurance policy, so please include. You should know that serving together is a rare gem and veteran outreach, and it literally saved my life. Without them, veterans like myself will fall through the cracks and be lost. So please acknowledge serving together is a great investment for our taxpayers' dollars in the efforts to keep veterans such as myself, for the lack of a better word, alive. One last thing, if you have any job opportunities, give me a chance. I work hard for you and you won't regret hiring me. Get in touch with EveryMind's if you have any opportunities. Thank you.
Now we hear from Senator Van Hollen.
Well, thank you, Ike. And I want to start by saluting Roderick, not just for his service, but for sharing his story and his testimonial about the important work of serving together. And it just underscores the urgency of this work and why we all have to pull together to do it. And I do want to salute Director Christy Kennedy, who Roderick just mentioned, and the entire Serving Together family for what you do to support our veterans, not only with healthcare resources, although that's essential, but also with things like housing and education and job opportunities and much more. I'm really pleased to see that this organization, which was launched a little while back, has really been making a difference in people's lives. And I also want to acknowledge the leaders of EveryMind who work hard every day to deliver mental health support to Americans of all different backgrounds and facing different challenges. CEO Ann Mazer, we heard from her at the beginning, to the Chief Program Officer, Karishma Sheth. And I do want to take a quick moment just to thank my friend and our former county executive, Ike Leggett, who served our country in the military and then served Montgomery County as our county executive. And during his years here, we were able to work to get vouchers, the vouchers, VA vouchers, and make Montgomery County one of the first jurisdictions in the country to eliminate veterans' homelessness. That obviously is a constant work in progress, but I want to thank him for his focus on veterans issues. And you're going to hear shortly from my good friend and colleague from across the Potomac River, Senator Tim Kaine, who has been a real champion for veterans issues. As Ike Leggett said, we're gathered here today to confront a difficult issue, but one we must confront with urgency. And County Executive Leggett mentioned the alarming statistics. We're in the middle of a COVID-19 pandemic, but we're in the middle of a veteran suicide epidemic. And the numbers that Ike cited show that veteran suicide is 1.5 times more than the national average for those who have not served. And if you look closely, 11 of the 18 veterans who take their lives every day are not in the VHA care service. So we've got a situation where men and women who served our country in the military face a host of hardships when they come back home. So often, unfortunately, their service on the front lines for our country is met with adversity when they return to civilian life. And we've got to do a lot better, as Ike Leggett said. Yes, of course, we want to thank our veterans for their service to their country, but the way to really thank them is to be providing help on these essential issues: mental health support, housing support, job opportunities, dealing with food insecurity. All those issues are present at any time, but veterans are facing an acute sense of isolation right now during this COVID-19 pandemic. So what do we do? Well, in Maryland and throughout this region, we've got to amplify and support the work already being done by nonprofits like Serving Together that lead the charge on education and programming designed to destigmatize mental health challenges and develop coordinated care. And I know we're going to be hearing from Richard Mckeon. I want to thank him for his work at SAMHSA over the years. It also means expanding the number and quality of our CBOCs, our community-based outpatient clinics, which provide vital services to veterans and their families. And I am pleased that after many, many years of work, we were able to open a CBOC in Montgomery County, Maryland in the year 2018, which does deliver those important wraparound services, including primary care, women's health, mental health, and social work. And it is a model for how we can support our service members once they re-enter civilian life. And I will also say that despite the polarization on Capitol Hill on so many issues, supporting our veterans is one area where we come together with a clearly shared mission and priority. And as Ike Leggett mentioned, we passed the John Scott Hanson legislation in 2019. But I think everyone recognizes passing a bill is just the first step. Now it's our job to work with you and make sure that you have the resources to fully implement that legislation, which expands and elevates healthcare services that we provide to veterans in Maryland and across the country. So let me close by thanking everybody who's part of providing these services, everybody who's part of addressing the urgent matter of veterans suicide. And I look forward to working with you in the days ahead, continue to work with you to address this urgent matter for our country, making sure that those who have served us are not just met with rhetorical thanks, but real support from a grateful nation. I know Tim Kaine shares that mission, and I'm grateful for all of you for being on the ground to implement it.
Thank you.
Well, Chris, Tim Kaine here. What a treat to be on with you on this really important topic. Let me start by thanking Ike Leggett, who really is an institution so revered for his government service as a county exec, service in political work, wonderful service as a veteran during the Vietnam War. Great to be on with Ike, with Christy and Ann, and my friend Chris Van Hollen. Roderick's testimony was very powerful. This is an issue, veteran mental health, the prevention of military and veteran suicide, that's very important to me in my work, because I represent Virginia, which is so tied to the military, and I'm a member of the Armed Services Committee. And it's also important to me as a dad. My oldest boy is a Marine infantry commander who just after 8 years and 2 overseas deployments transitioned from active duty to reserve status on July 1. And Chris, you'll be glad to hear this. His reserve job is as managing the Marine for Life program, which helps any Marine transitioning from active to civilian life who wants to live in the state of Maryland adjust that transition. And that's what my son Nat's reserve job is. And so he's very active in this transition as you're going from active duty to civilian status. And it turns out, as a member of the Armed Services Committee and those on the Veterans Committee, we look at the grim statistics that Ike cited. Nearly 18 veterans commit suicide a day, and we research as to why, and we find out some very powerful things. I think an initial hypothesis was that veteran suicide would be driven heavily by PTSD, the after effect of trauma and shock. And yet it turns out that that isn't the biggest predictor of veterans' mental health and issues. It's certainly a contributor, but many mental health issues that veterans experience are veterans who haven't been deployed in combat. And it turns out that a significant factor, maybe the most significant, and it's one that we can all address together and need to, is this transition from being in a military where you are surrounded by a very supportive group of people who know what you're doing 24/7 and will notice if things are wrong and try to help you out, transitioning from that close-knit, sometimes maybe too close-knit, but close-knit environment to a civilian life where you feel like you don't have people that have your back. The isolation factor, the I've lost my support network factor, that turns out to be a critical bit of what the research and science shows us about veterans' mental health and suicide issues. And that's why I like the name of your program, Serving Together, because it's the togetherness that's needed. Certainly mental health treatment and destigmatizing, seeking mental health, but it's ultimately building up a network so that no one feels isolated or alone when they transition from active duty to civilian life. I want to just make one offer to you, and I hope you'll take me up on it going forward. I'm not on the Veterans Committee, but I am on the Armed Services Committee. And every year we get a defense bill done. We work on it in the spring. We usually pass it out of the committee around Memorial Day, try to get it done on the floor. And we just completed the 60th year in a row. We got a defense bill to the president's desk. He vetoed it this time, but we overrode the veto, so it becomes law. An awful lot of good for veterans' mental health issues really has to start with smart mental health strategies while people are in active service that can help them when they make the transition into veteran status. So I was a proud co-sponsor of the John Scott Hannon Veterans Mental Health Care Improvement Act. That was a bill that came through the Veterans Committee. But every year in the Armed Services Committee, we also have the opportunity to do right by mental health of those in the military and their families, and building long-term strategies for mental health that can last through active service into veteran status and beyond. So I just want to offer to you, with Serving Together and EveryMind, that we will start working on next year's defense bill probably by the end of February. We just confirmed the Secretary of Defense, Lloyd Austin. We talked to him about quality of life issues like mental health, very important issues in his confirmation hearing. We'll start to prepare for the bill almost immediately. And if you have policy ideas about things that we can do while someone's in active service that can build effective mental health resilience strategies for the rest of their lives, please reach out to me or other members of the committee. The Veterans Committee is working on this from the veteran side every day, but the Armed Services Committee, we sort of feel like if we do it right, we can kind of go upstream on the problem and put strategies in place that will make the numbers that Ike Leggett cited at some point a relic of a past that we've left behind to find a better day. So to all of you, and I know there's going to be a great panel discussion afterward, to my friend Chris for the great work that he does on behalf of veterans in Maryland and beyond. Your work, it matters now more than ever, and I look forward to being your partner going forward.
Thank you, Senator. We've just heard from two outstanding public servants who really understand the challenges that we're facing at the national level and what they've done in order to assist us going forward. These are two outstanding public servants. Now we're going to hear from Dana Burrell and Brandy Chikatis, who are both working on the Governor's Challenge and Ask the Question campaign. Dana is the Program Director of Outreach and Advocacy Program, Maryland Department of Veterans Affairs, and Brandy is Director, Virginia Veterans and Family Support, Virginia Department of Veterans Services. Please take it over.
Good morning. Thank you very much for the opportunity to be here, and thank you, former County Executive Leggett, for that very kind introduction. On behalf of Governor Hogan, Lieutenant Governor Rutherford, and Secretary George Owings, thank you for the opportunity again today to join such an esteemed panel of guests. As was just indicated, my name is Dana Burrell. I serve as the Director of Outreach and Advocacy for the Maryland Department of Veterans Affairs. I've been with the department for the past 7 years, and for 12 years, I also served as an active duty military spouse. I have lived the spouse experience and have borne witness to the effects of multiple combat deployments and transition to civilian life on a service member, a spouse, and their children. The prevention of suicide is a national priority. It is a state priority, and I can tell you that it is a priority for Maryland state government. Last May, Maryland accepted the SAMHSA VA invitation to participate in the Governor's Challenge to Prevent Suicide among service members, veterans, and their families. Federal, state, and local partners from both the military and civilian sectors were invited to join a team to frame a Maryland-based action plan for preventing suicide. For the better part of 2020, this team, led by Joy Ashcraft, Director of Maryland's Commitment to Veterans, and myself, have tirelessly worked to develop this plan. It was presented to SAMHSA in September of 2020 and is based on evidence-based policies and practices. Our plan has 4 focused priority areas: identifying SMVF and screening for suicide risk, promoting connectedness and improving care transitions, increasing lethal means safety and safety planning, and peer support. In March, our team will participate in an implementation academy to operationalize strategies within each of the 4 priority areas. In November of 2020, Governor Hogan announced the launch of Maryland's Ask the Question campaign. The campaign addresses priority area number 1 and encourages human services professionals, including government, to incorporate the question, have you or a loved one ever served in the military, into their intake processes. Using a phased-in approach, the campaign first focuses on educating and building awareness, providing scripts to organizations on how to ask the question, and on what to do when someone answers yes to the question. Information on the campaign, training opportunities, and resources are currently housed on the MDVA website. We are thankful to Trinity Health and to the states of Virginia, New Hampshire, and Connecticut for their insight into how to successfully launch this campaign. Participation in the Governor's Challenge could not come at a better time. During the 2019 legislative session, legislation, specifically Senate Bill 521, was passed by the Maryland General Assembly and signed into law by Governor Hogan, requiring the Maryland Department of Health, with support from our department, the Federal VA, and SAMHSA, to create a comprehensive statewide veteran suicide prevention plan. The first report, due to the Governor and General Assembly by July 1 of 2021, will include statutory, administrative, and budgetary recommendations for implementing short-term strategies for reducing the incidence and prevalence of death by suicide in Maryland's SMVF population. The action plan, submitted to SAMHSA in September of 2020, and the implementation strategies to be developed this coming March will inform the content of this report. Maryland is fortunate in that we rank very low across the nation in terms of veteran death by suicide. However, there is still much work to be done. It is only when our federal, state, and local partners work together on prevention and intervention strategies that we will reduce risk, prevent suicide, and improve wellness in our SMVF population. On behalf of MDVA, we are thankful for the work done by EveryMind and Serving Together, and for their ongoing partnership with our department. Thank you very much.
Well, good morning, everyone. I'm Brandy Jankaitis. Thank you, Dana. It has been an honor to work with the Maryland team in this Governor's Challenge process. And thank you to EveryMind and Serving Together for bringing us together this morning to talk about our efforts here in Virginia and across the nation. In Virginia, a special thank you to Senator Kaine and Delegate Kathleen Murphy for their leadership, and to all of our suicide prevention champions around the state. Many of our Governor's Challenge team members are represented here in the event. So in Virginia, we were one of the first 7 states to join the Governor's Challenge to Prevent Suicide process. We joined the team in January of 2019. And as Dana highlighted, the Governor's Challenge process gives a platform for strategic planning to take a public health approach and a call to action for states to implement the VA's national strategy for the prevention of veteran suicide. In Virginia, our team is led at the secretariat level by Secretary of Veterans and Defense Affairs, Carlos Hopkins, and Secretary of Health and Human Resources, Dr. Daniel Carey. So what we have is this blend of military and veteran leadership at the state level and the agencies under that secretariat, like our Virginia Department of Veteran Services and our National Guard, and then under Health and Human Resources, all of the health and human services agencies we need to make this a complete picture. And then we have a robust team of our VA partners, DoD partners, veteran service organizations, nonprofits, and all of us lending time and talents to this critical mission. Dana highlighted the key priorities for the Governor's Challenge process. We share those priorities here in the Commonwealth, and with our short time frame this morning, I just want to highlight our VISOR pilot, Virginia's Identify, Screen, and Refer pilot. This pilot embodies the priorities of the Governor's Challenge process, and it tasked community agencies with training staff in military culture, suicide prevention, safety planning, and most critically, to start risk screening in their services. And some started it from scratch. And we started the process for the pilot a year ago, and in the infamous 2020, no less. So we had agencies stepping up to do more on behalf of suicide prevention for the SMVF community during a global pandemic, voluntarily with no additional resources. So special shout out to all of our VISOR pilot partners. And we learned a couple of things that I want to highlight. And that is that when community agencies start screening in their services delivery, lives are saved. For instance, in just 6 months of data collection for the pilot, over 2,300 service members, veterans, and families were screened for suicide risk. And of those, 30% screened at risk for suicide. And we shudder to think, if we hadn't been doing the pilot, how many would have gone unidentified in our pilot partner agencies, which included hospitals, public mental health centers, local departments of social services, our state Department of Veterans Services. How many would have been struggling and gone unidentified? But because of the pilot, they were identified and resources were deployed and outcomes accomplished, positive wellness outcomes. And we've learned from focusing on screening among the SMVF population, how to apply it to all Virginians. So just to close out this briefer portion, and Dana and I will join you at the end for a Q&A to dig in and talk more about our efforts in Maryland and Virginia. But to close out, the Governor's Challenge process has really created a platform for comprehensive suicide prevention in Virginia, and also for legislative and budget action that will be highlighted throughout this event. So thank you to Dr. Richard Mckeon and our entire SMVF TA Center team for your support throughout. Thank you all.
Every year, the Montgomery County Hotline answers over 21,000 calls, many of those from veterans. Thanks to the expertise of our colleagues at Serving Together, we know where to direct them for the best support. After 2 tours in Iraq, 32-year-old Drew returned to civilian life, ready to turn the page on the trauma he experienced. Sadly, the excitement was short-lived. Drew had lost interest in things he used to enjoy, like football. He found himself jittery in crowded places. Loud noises set him on edge. His mind often felt foggy, and it was hard to remember things. Drew's wife, Christy, was extremely worried. She missed her fun-loving, outgoing husband. Drew was irritable and moody. He couldn't focus enough to have a conversation. Drew often clashed with coworkers and lost several jobs. Finances were tight. Alcohol was the only relief he could find. One night, after an intense fight with Christy, Drew felt he could no longer deal with the pain. He took the gun out of the gun safe. He thought about his battle buddy Adam, who died by suicide. Drew remembered the hotline number he looked up for Adam, but never got the chance to give him. It was still stored in his phone. He clicked the number.
Montgomery County Hotline, this is Mary.
I don't know what to do anymore.
I'm so glad you called. I can hear how difficult things are for you right now. You're not alone. I'm here to talk with you and support you for as long as you need. This is a safe and confidential space. Tell me what's on your mind.
My wife just left me. I've got nothing left.
From here, our call specialist provided an empathic and supportive presence for Drew to articulate for the first time what he was truly going through. Mary used de-escalation technique to get Drew to put the gun in his car trunk. She validated Drew's struggles and pain. She made sure Drew understands that it is not uncommon to find civilian life challenging after the trauma he experienced during deployment. She worked collaboratively with Drew to come up with a personalized safety plan. More importantly, Mary connected Drew with our colleagues at Serving Together. Serving Together has the knowledge and experience to follow up with veterans and make sure they have support that they deserve every step of the way.
Today, Drew has finally been diagnosed and treated for PTSD. He works with Christy in couples counseling. He started a new job at a local landscaping company and attends AA meetings regularly. Recovery is not linear, and things can still get hard sometimes. But Drew knows, just like on that fateful night, Hotline and Serving Together are always here. When he can't sleep in the small hours of the morning, or when he can't get a hold of his therapist on the weekends, he knows a listening ear and a caring heart are just a call, text, or chat away. He is
Good morning. This is Dr. Richard Mckeon from the Substance Abuse and Mental Health Services Administration. I'm very pleased to be with you today. And I want to start by thanking EveryMind for the great work that they do every day. In particular, I want to thank them for being one of the 180 crisis centers who are part of the National Suicide Prevention Lifeline Network, which last year answered almost 2.2 million calls from Americans at risk for suicide. And each time someone calls the National Suicide Prevention Lifeline, they have the option of pressing 1 to be connected to the Veterans Crisis Line. And about 1/3 of those 2.2 million callers last year did press 1 to be connected to the Veterans Crisis Line. I also want to thank our distinguished senators, Senator Chris Van Hollen from Maryland, Senator Tim Kaine from Virginia for their great work, and for former Montgomery County Executive Ike Leggett. I've been privileged to work with both the Maryland and Virginia teams that Dana and Brandy have spoken about. I was privileged actually to go down to Richmond to see Brandy's team in action. As part of SAMHSA's support, in coordination with the Veterans Administration for the governor's and mayor's challenges. And I think that with the passage of the John Scott Hannon Act, which will begin to bring resources into communities in the not too distant future, we are hopeful that efforts such as the Virginia Governor's Challenge and the Maryland's Governor's Challenge can be greatly strengthened. And we are working with the VA to bring these Governor's Challenge and Mayor's Challenge work to more states and cities in 2021. Let me now introduce an esteemed panel who we'll be hearing from today. First, and I'll introduce all three and then I'll pose them some questions. Delegate Kathleen Murphy from the state of Virginia. She's represented Virginia's 34th district for the past 6 years. She's a member of the House Finance, Transportation, and General Laws committees. She is the vice chair of the House Democratic Caucus and also belongs to the Military and Veterans Caucus and the Virginia Empowerment and Renewable Energy Caucus. She also serves on the board of Veteran Services and chairs the Women Veterans Work Group. Senator Will Smith from Maryland represents District 20. He was elected to the Maryland House of Delegates in 2014 and then joined the Senate in 2016. And he is the chair of the Judicial Proceedings Committee. It was during law school that Senator Smith first sought a commission as an officer in the U.S. Navy Reserves, a position which he continues to serve in today. He's currently assigned to a unit at the Pentagon, and from March through October 2019, he was deployed to Kabul, Afghanistan, in support of Operation Freedom Sentinel. And then Council Member Robert C. White from Washington, D.C. He is an at-large member of the Council of the District of Columbia, chair of the Metropolitan Washington Council of Governments Board of Directors. He served on the D.C. Council since September 2016 and is chairperson of the Committee on Government Operations and Facilities. He also serves on several other committees, including Human Services, Housing and Executive Administration, and Labor and Workforce Development. And so my first question is going to be for all three of our panelists. And so we'd like to ask each of you to respond. What do you think are the unique challenges and some of the key barriers you face in your region in reaching the veteran population in order to help prevent veteran suicide? Delegate Murphy, perhaps you could go first.
Well, my focus really has been on women veterans. I see so many programs that genuinely are male oriented. And I think that in a lot of ways, our women veterans are invisible. I am very grateful to Brandy and all that she has brought to the table for all of us, and to Beverly Van Thol and Annie Walker and the team, and Carlos Hopkins at our Veterans Administration. They've been amazing. When I went on the Board of Veteran Services, though, there were 104,000 women veterans, and remarkably, there was no women veterans coordinator in Virginia. And I don't know if that's the same in other states. We now have 107,000 women veterans in Virginia. It's a growing population. And the problem is the services are really geared toward men. And I think that needs to change. I think one suicide is a tragedy that we have to fight back against, but so is homelessness. And the homelessness that women experience, because they often end up being in charge of the children without a job. There are women living in cars with kids. And these are things that we really need to address. And I don't think we're effectively addressing them. And I think those kinds of things would really help prevent suicide and make those numbers go down.
Senator Smith?
Well, good morning, everyone, and thank you for having us. It's good to see you, and it's always good to see our former county executive, a veteran and esteemed public servant, Ike Leggett. So good to see you, and thank you for all you've done. And to the senators, Senator Van Hollen, Kaine, and I know our council president is here as well, Tom Hucker. And Robert, good to see you. Thank you for texting me and all that good stuff. It's good to see you. So to answer your question, I remember, I'm just harking back to my own experience, which is in the reserves, but then having, relatively recently come back from Afghanistan, is that you go to a warrior transition program in Germany, at least for the Navy, then you come back to Norfolk, you get kind of plussed up, you made aware of some of the resources that you've got now as a veteran, you get your DD-214, and then you leave Norfolk and you're off and you're on your way. And as Senator Kaine mentioned before, that can be the transition can be difficult because either you've come from a combat situation or you've come from a situation in which you had, a mission-driven centric job and you had the resources there, the support resources and a kind of a team mentality, whereas you go back and you can sometimes be aimless or directionless. And so some of the things that I've identified in Maryland, and I think we've done a fantastic job here actually. And so I want to give, all credit to Dana and our Secretary Owens for their great work, but a lot of times the resources aren't there in terms of just availability and access, and people don't know what resources the state has. So, for instance, last year, I sponsored and we passed a veteran suicide prevention comprehensive action plan, which ensures that we lean forward and we go out to our veterans communities and make sure that they understand what resources are available to them. But things like that, from all the way from veteran and mental health resources to I've received several complaints just this year that we have a veteran designation on our Maryland license, but some organizations and entities don't recognize that designation on the driver's license, and therefore that veteran will be denied in many cases certain benefits that they're entitled to. So everything from access and understanding of what resources are available to ease at which you can actually exercise and take your advantage of the benefits that you've earned as a veteran are challenges that we face here in Maryland. So those are things that I've been working on, and I appreciate the work that Delegate Murphy's worked on in Virginia, especially for women veterans. We had our first woman adjutant general in Maryland retired just a year and a half ago, and she made that part of a cornerstone of her work. And so I admire your work and I appreciate your awareness on that issue as well. So happy to be here and thank you all for the work that you're doing.
Thank you, Senator Smith. Councilmember White.
Thanks so much, and thank you for having me. I do want to start by recognizing the leadership and work that both Delegate Murphy and Senator Smith have done in this area. I'm lucky to know both of them personally and have seen their work supporting veterans and our active military individuals and families. In the District of Columbia, we have about 30,000 veterans, mostly people of color. And one of the biggest hurdles that we have had to serving our veterans in this capacity is the stigma around mental health, both for veterans, but also in communities of color. I think, culturally with younger generations moving up the ranks, this is something that the stigma that we're starting to shed, but we have to be more active and more vigilant in making sure that we break down these barriers that prevent people from seeking help and from getting help. We also have a unique issue in the district, probably, I assume, because of our small geographic size and our population of just over 700,000 residents, where we don't have groups that are as active on veterans issues as we see in many states. Now that veteran issues are under my committee as of about 3 weeks ago, what I'm hoping to do is diagnose what's going on with that pipeline of information, the pipeline of needs, so that we can better understand the needs of our veterans and make sure we break down those barriers in a real way.
I'd like to mention that one of the things that I've done to address the issue for women veterans is to institute a series of women veterans roundtables, which we've held across the Commonwealth. And these roundtables, you know, started off honestly like a crying session. You know, people were so devastated in so many ways. And as they've evolved, they've really become dynamic and they've really opened some doors for women. So I would honestly tell you that having these roundtables for our veterans and listening to them firsthand, people who are elected and who they feel can have an impact for them, I think has been really helpful. And I'm certainly glad that I started doing that and will continue to do it as I move forward as a delegate.
So that leads right into my next question. How would the three of you feel that that cooperation and coordination in the region as a whole, in Maryland, Virginia, and the district, might help our nation's veterans?
Included in Women Veterans Roundtables by Mayor Bowser. She's been very generous in opening her door and allowing me to be part of some of the things that she is trying to put in place for veterans. So I'm very admiring of that inclusion and really appreciate it.
They also are further supportive of organizations like EveryMind and Serving Together. I mean, these are organizations that are critical of bringing those resources together because obviously, as Councilman White and Delegate Murphy have pointed out, look, our region is veteran heavy, and Virginia probably being the leader of that, but we've so many veterans in our tri-state, our tri-jurisdiction area that it's the cooperation is paramount. And so Serving Together, EveryMind, you serve, I mean, we have a great location in my district here in Silver Spring, but a lot of the folks that avail themselves of the services are from Washington, D.C. or even Virginia. So it's a regional approach that I think that we need to invest in particular for folks that are coming back. I mean, you're armed with unique skills that you learn in the military, but one thing that I think one disconnect is transferring those skill sets which are portable and getting them into the market, our local marketplace. And that doesn't happen as seamlessly as one would suspect. And so organizations like you know, EveryMind and the Serving Together program help connect those folks and, you know, make sure that they're aware of educational opportunities so they can plus up on the skills that they've earned and learned in the military. Our Maryland Department of Veterans Affairs, they have like 5 core programs that are aimed at doing that type of outreach. So I think the more that we can invest in those types of programs, the better we'll do regionally.
In the district, I'm very glad that Delegate Murphy mentioned the roundtables. We have, I think, at least 2 coming up. And on February 19th, I'm hosting my first hearing on veterans issues. So folks who are engaged in this issues in DC, I encourage you to come to that hearing and participate. Like Virginia and Maryland, we have an Office of Veterans Affairs that helps folks get to resources, assist with claims, anything that you need help with in the district. We try to make sure our Office of Veterans Affairs can help you. We also have a Vets Ride program. It's making rideshare free or affordable for veterans to get to anything from educational opportunities to medical appointments, accessing food. This is a program that we have found to be tremendously useful so far. I don't know how widespread this is across the country, but it is something that has seen some great utility here in the District of Columbia.
Great, thank you. I noticed our question that in the chat, which was basically talking about how the difficulty at times in accessing services during an acute crisis, not things like the crisis hotline, such as the Veterans Crisis Line or the one that's answered at EveryMind. So my question would be, what is your sense of the availability and needs in terms of crisis services in your areas and the accessibility of crisis services as one important piece of what's needed to reduce veteran suicide?
Is always the problem. It's always the problem. We have great ideas, we have great intentions, and then we get to the appropriations committee and we run into a brick wall. It's been hard. A lot of areas in Virginia, I know, don't have a person easily accessible. I think these are critical, and I think we have to figure out a way to spread the love, get people out there in communities so that when we have a veteran who has a problem, they know that there's an office they can walk into. But it's a financial issue for sure.
Senator Smith?
Sure, I think it's certainly a financial issue, but as we're still very much in the midst of the pandemic, and just ensuring that folks understand that those resources are still available and accessible. Obviously, there are new challenges at accessing those resources, but and the pandemic has highlighted and exacerbated a number of the inequities that exist. As Councilmember White talked about, some of the inequities, especially with respect to a high African-American veteran population. I think even amongst veterans, you've seen that some of the health disparities in terms of accessing not only physical health, but mental health resources, the gulf there is wide. So just making sure that our populations understand and our communities understand that those resources are still there. I obviously agree with Delegate Murphy that the money is always the paramount thing that we struggle with, but understanding that resources are still accessible, even in the midst of the pandemic.
Sorry, and not to be a broken record on this, but being able to tap into the financial resources allows us to move from the ideas that come up at these roundtables, and someone mentioned this in the chat, to making sure that the needs that are identified in these roundtables come to bear and really are turned into opportunities or extensions of agencies to make sure that there is someone that veterans can touch when they need. In the district, I think we still rely too much on nonprofits and on national services like the Suicide Prevention Hotline, and we have to really move to a warmer, more localized space.
In a way, it's like saying there are doors that are open. People just need to find those open doors. And so, it's like having a leader. It's having somebody they can call and say, where do I turn? Where do I go? And I think that really is an important issue, and why these veteran coordinators are so important and play such an important role for all our veterans.
Thank you for your responses. Let me just mention that on the federal level, in the appropriations bill that was passed by the Congress and signed into law in December, there's now a 5% set aside for crisis services in the SAMHSA mental health block grant. Also in the National Suicide Hotline Designation Act that was signed into law in October, SAMHSA is required to do a report to Congress on the resources needed to make the new 3-digit National Suicide Prevention Lifeline number, which will be 988. What are the resources necessary to make that operational and effective by its universal operation date of July 2022? And finally, SAMHSA has published guidelines for national guidelines for behavioral health crisis services that speak to the importance of crisis call centers that can serve as a coordinating hub, mobile outreach services in communities, and crisis stabilization units. And that's available on the SAMHSA website. So we are running low on time, but I want to thank each of our panelists for your time this morning, for the great work that you have been doing. And I believe that at this point we transition back to Ike Leggett for his next section.
Thank you, Dr. McKinnon, and thank all of the panelists for their great work. Outstanding information provided. We're going to go right now to some of the things that are happening at the local level. A person who's been working with veterans for most of his life and really as county executive of Montgomery County, outstanding public servant, Mark Eldridge. Mark, please come on.
Let me get my audio set.
Okay.
Okay. Can you all hear me?
Yes.
Good. First, I want to thank you all for asking me to join you today. I got to say, I'm somebody who grew up in the 60s, and, so I've seen lots of veterans, come through, my life and through this world. And, America's not done a terribly good job of treating veterans the way one would expect them to be treated. And I always think about, how my father and, his generation was treated when they came back from World War II. And it has not been the same for veterans. I want to, particularly thank Ike for the work he did in Montgomery County to really bring attention to the veteran issues and make sure the county put programs in place that could help veterans in Montgomery County. That was absolutely critical to us. And I think the one enhancement that I was able to do is that I've brought that into the base budget so that this operation is no longer subject to whether or not it gets funded through the grants process, but this is now part of the base in Montgomery County. That means it's planted in the county. It's something that's going to be ongoing and permanent and not subject to the vicissitudes of a council during a particular year, or of an executive, frankly, during a particular year. So I'm really happy that we're able to do that. I also want to thank EveryMind and all the work they're doing. You placed such a big role in Montgomery County in mental health issues, not just on veterans, but on issues for in other aspects of mental health. And this is just another example of the really important work that you're doing in the community. Before COVID hit, I will say the county and the city of Rockville were working with the Veterans Administration on trying to locate a veterans living center medical facility inside Montgomery County. And I'm hoping that post-COVID, we're able to continue our work on that because we were working with the state and with, like I said, with the city of Rockville and with my government to see if we can make that possible here. And we've got a tentative location, and I'd like to be able to do that. I was on a tour of the facility that we had up in the Shady Grove, Germantown area, and I was just really impressed when I went through the opening there and got to talk to the doctors and everything that's been put in there. It is really, really an outstanding effort. The work, in the mental health field is ongoing. We continue to struggle, I think, as everybody does, with adequate supports for people in the mental health arena. And we are going to have to still figure out how we do more. But I'm very happy with, the efforts that have been made. And we're going to continue to be supportive as a county government. And I think people always look at the work that Ike did as, really, kind of setting the mark and establishing a baseline that the county has to have a commitment to helping the veterans who are in our community. We're going to continue to do that. And I just remembered yesterday, this very weekend, I was on a tour of a new affordable housing building in Silver Spring, and 11 of those units have been put aside for veterans, and they're income controlled. So it is really important, and I was really happy. It's the first time I've been in the building here that it set aside space for veterans, and that's something else we need to do more of. So thank you for giving me an opportunity to join you this morning.
Thank you, Mark. And again, thank our panelists for an outstanding presentation. All of this work this morning is geared toward making certain that we follow through to ensure that the things that we have on paper, we're able to translate into real action. And so here's some things that we need to think about that we can do. First of all, our call to action should reflect some of the things that I think we've heard this morning, the impact of minorities, women, how we transition, a great deal of things that I think are quite important to make certain that we move from legislation on paper to action implementation. In order to help us, here's some things you can do. First of all, you could work with us to promote legislation like S785 in your own region that supports mental health and prioritize suicide prevention. You can identify and introduce us to contacts that support this work or who would like to know more about how they can make an impact supporting suicide prevention in military-connected communities and beyond. You can also become a partner, an ambassador as well, of EveryMind's mission and programs, because every mind deserves to be supported. Those are some of the things that you can do right now, but be forceful and help us to implement these programs. Next, we're going to hear from another person at the local level. We've just heard from County Executive Eldridge about things that the county is doing in Montgomery County and the work that he is doing to ensure that we get a hold of the problem that we're facing with suicide prevention among veterans. Tom Hucker, the new elected president of the Montgomery County Council, we're going to hear from him right now. Tom, come forward.
Thanks so much, Ike. Thanks for the introduction, but thanks especially for all your leadership on these issues, in addition to your personal service for so many decades. Good morning, everyone. It's great to see so many leaders and advocates that don't always agree on every issue come together around this really critical issue and this important milestone that we're celebrating. So thanks to Senators Van Hollen and Senator Kaine and County Executive Leggett and County Executive Eldridge and my state senator, Will Smith, and my colleague on the Council of Governments board, Chairman White. And thanks so much to EveryMind CEO Ann Mazer and all of the staff at EveryMind for all the hard work that you do every day to serve those who have served our country and are just too easily, historically have been too easily forgotten and need this vital service. I want to add my congratulations to serving together on the 10-year anniversary of providing those critical services to our military and veteran community. I echo everything that County Executive Eldridge mentioned about the budget reforms and our commitment at the highest levels in the Montgomery County government to the important work that you're doing. I can tell you the County Council, as well as the entire Montgomery County government, is committed to supporting EveryMind's mission and to the important programming initiatives like Serving Together and the 21,000 calls that EveryMind takes every single year, like we heard in the video earlier. Those calls can't be missed, and I can't think of any higher priority from in our county budget than making sure those get answered competently and effectively and on the first ring. It really has shown, I think, what we can do together when we have high performing professional nonprofits like EveryMind working with the county government. We're so proud that Serving Together was started right here in Montgomery County. It's been inspiring to watch the program grow and expand in the whole metro area over the last decade and to serve well beyond Montgomery County. It's a tragedy that so many veterans still die by suicide, and it's unacceptable, and we all have a special responsibility to address that and provide those services to our veterans. So again, so grateful on behalf of all my colleagues for everything that EveryMind is doing. We've come a long way together, but obviously the work is nowhere near finished. So I really look forward to continued collaboration and to a lasting partnership that uplifts and strengthens our veterans and all their families and gives them everything that they deserve. Thank you so much for holding this great event today. Thank you, Ike, again for your leadership, and look forward to continuing to work with you throughout the year.
Thank you, County Council President Hucker. What an amazing program we've had so far today. My name is Amsa Heck, and I am the Chief Development Officer here at EveryMind. I'm also a proud U.S. Air Force veteran spouse. My husband served in the Air Force active duty and then the reserves for a total of 31 years and just retired this September. And we feel these issues very much in the transition and the lack of support that's available, the difficulty and the challenges to get to the support that's available. And I just want to take a moment to talk about the toll that military operational tempo, the culture of strength and stigma, and the lack of access to mental health care and wraparound services has taken on our service members and also on their families and on our military community. Every day, but especially in recent weeks, the issue has touched every American and been in national headlines. I want to give a heartfelt thank you to our esteemed speakers, Ike, our master of ceremonies, our sponsors and partners, our amazing team here at EveryMind and at Serving Together, and to you, our audience, for being a part of today's program. We must never forget the numbers that Ike and Senators Van Hollen and Kaine spoke about. 17.6 veterans die of suicide every day. 11 are not in VA care. 11. This is a conversation we can't stop engaging in until the mental health crisis and epidemic of suicide in our communities is abated. Our leaders, our lawmakers at every level of government have shown their commitment to this issue. Community organizations like EveryMind and our partners are working together to deliver the direct services and wraparound care and support veterans, service members, and their families need to feel connected to the communities in which they live. This is how we address each individual's specific barriers to mental health and wellness. And I want to reiterate what Ike said about what you can do right now. You can work with us. You've heard many of our esteemed speakers today talk about being open to policy and to working with all of us, the providers on this call, and civilians in the community to draft legislation, to draft policy, to talk about what's really needed to implement these bills, to implement US S785 and the other bills that were signed into law on January 5th, and the bills that are coming. We need to work together. We need to introduce one another to contacts that support this work and who'd like to know more about what they can do to prevent suicide and positively impact military-connected communities. We want you on this call, if you're not already working with us, to become an ambassador. Talk about our mission in your communities. Talk about our work to make sure that your communities are getting access to the care that they need. And partner with us so that we can help build your capacity from every corner of our organization. For those of you who have to jump off, please remember to watch the recording of this next portion of the program. We know it's been a little bit more than an hour, and we really value the time that you've given us and are so grateful that you're now part of this conversation. Next, we're going to move to questions and answers. We asked registrants to send in their questions prior to signing on so that we could incorporate the answers you want to hear in today's program. For those of you who are able to stay with us, welcome. I'm excited to have you here. To help facilitate this conversation, it is my great pleasure to introduce my friend, colleague, and fellow military spouse, Christy Kennedy, Director of Serving Together. Christy?
Hi, good morning, everyone. I am Christy Kennedy. I'm Director of Serving Together. I've been with Serving Together for over 4.5 years now. I'm also a military spouse, like my fellow friend and colleague, Amsa Heck. My husband serves in the Air Force. He's currently active duty, stationed out of Joint Base Andrews. We've been in this area for a long time and have really enjoyed being a part of the National Capital Region and this greater region that is doing so much work to support our military veterans and their families. I also want to bring back on Brandy Jankaitis and Dana Burrell, who we heard from earlier, talking about the important work that they're doing within the Commonwealth of Virginia and the state of Maryland. We want to be able to answer some questions collectively together to support, the many military veterans and their families that need us during this time. So with that, I do want to kind of start and ask a first question. And I'll probably start with Dana and then move over to Brandy. But Dana, what are you excited about in 2021 as challenge teams for SAMHSA's Governor's Challenge?
I think probably first and foremost, as I mentioned during my briefing, the Implementation Academy that will be initiated in March. The support and subject matter expertise that we have received from SAMHSA and our VA partners, as well as our VA partners in other states, has just been absolutely exceptional. I don't think that we would be as close to where we are in terms of writing the plan that's due to the General Assembly in July without that support. So I would say first and foremost, it is the Implementation Academy. And seeing how that academy and the work that we do is able to translate and inform that plan that we'll be submitting to the General Assembly.
Wonderful. Brandy?
Yes, thank you. It's so hard, as Dana, I'm sure, experienced, to narrow it down to what we're so excited about, because our team is really doing amazing things. But just as a couple of highlights, Visor 2.0. So expanding that suicide risk screening pilot. We had 19 agencies join on for the first iteration in 2020, but the call to action here in the Commonwealth is how does each pilot partner expand into one additional program or one sister agency, and our own Virginia Department of Veterans Services is responding to that call to action, and we're expanding from our service line focused on peer and family support and resource coordination, Virginia Veteran and Family Support, and moving into our benefits service line. So this is staff around the state helping to file disability compensation and other benefits claims on behalf of veterans and families. And so they will now be coming on board with the suicide risk screening mission. And each of our partners is doing something similar. Also, we're partnering with a public mental health center in Suffolk in our Tidewater area to formally expand Governor's Challenge priorities. And we're really thrilled to have Western Tidewater Community Services Board coming on for that. And we were also recently approved for our 4th iteration of strategic planning in regional crisis services called Crisis Intercept Mapping, which is a phenomenal model that has been extremely instrumental in our Governor's Challenge efforts. And to squeeze one more in, we're thrilled to continue to expand and tailor our Lock and Talk Virginia Lethal Means Safety Initiative into the SMVF community. This is one of those great examples where you can take what you're already doing in the suicide prevention mission and tailor it to the military and veteran community. So in 2021, we'll be taking Lock and Talk Virginia into our Virginia National Guard with our suicide intervention officers, Directorate of Psychological Health, and the suicide prevention team within the National Guard. So couple of quick shout outs. We'll be busy.
Definitely sounds like it.
So we had a few people write in asking about COVID. 2020 has been a challenging year for many, and 2021 looks to be filled with similar challenges. Can you tell us about some of the pivots you've had to make in your programs and trends that you've seen in the community and with the organizations you're working with? And Dana.
So it has been a remarkable year. When we transitioned to full-time telework last March, I did not ever imagine that it would be January 2021 and I would be providing outreach remotely. Really had to take my outreach program as a whole and really almost flip it on its head to figure out how we were going to take what we would traditionally do face-to-face and move it into a virtual environment. But I can say with a bit of a learning curve in terms of learning to navigate Zoom and WebEx and Google Meet, that we have been able to continue providing outreach. Between my deputy director and I, our contacts and our events, virtual events, have all but doubled since the spring of last year, because we are able to utilize a virtual platform and engage with so many providers and local veterans commissions and county collaboratives. We can span the entire state of Maryland in 8 hours, and we could never do that before. It's also afforded us an opportunity to be able to provide training, to bring together my veteran services specialist liaisons to train them on the SAVE, the training that's provided by the VA, their suicide prevention training, which may have been a bit of a challenge to be able to bring so many state agency personnel to one physical location to be able to provide a training. I'm looking at how we can train our libraries, our Maryland State libraries, on suicide prevention and the SAVE training. We're looking at how we can train our local homeless providers, our departments of disability, aging, because we definitely do have an opportunity in the virtual space to be able to train so many people, more so than we ever would have been able to do prior. I think a challenge, though, that still remains is making that connection with the veteran community, which really wasn't. We had that challenge, I think, before to an extent, you know, with the resource fairs and things like that. It is a challenge to get our veteran community out to those events. But we are trying to be creative with the use of, you know, Facebook and Twitter to capture perhaps the population that we wouldn't otherwise be able to capture in a face-to-face environment. So while COVID has brought great challenge, I do firmly believe that it has brought success as well to us in terms of our outreach efforts, and specifically in the prevention space as well.
I'll echo Dana's comments that it definitely has been challenging, but there's silver lining too. So speaking from the Governor's Challenge process lens, many of our partners are on the front lines of the COVID response. Our local health districts and departments of health, our VA facilities, public mental health centers. And so for the Governor's Challenge process, which is voluntary and an additional job for many of our team members, we had to pivot and keep it flexible and feasible, even if that meant using the Governor's Challenge platform to connect on COVID resources and access updates, you know, keeping it as relevant as possible for challenge team members. And that really was helpful because as we all know, that now is the time more than ever to be talking about behavioral health and healthcare access and suicide prevention. So really the theme for the Governor's Challenge partners throughout COVID has been keep it flexible and feasible and be there for challenge team members when they need it. And, you know, within the Virginia Department of Veterans Services, like Dana talked about within her agency, we were constantly evaluating how to get to the SMVF community during this time. And for the most part, virtual had more positive than negative. But where it does present a barrier for veterans and families, our staff are doing their utmost to preserve in-person services where we can, with safety protocols, you know, relying on the good old telephone, not smartphone, but just phone calls, you know, and of course, video platforms where someone has access and they're comfortable. But really just doing our absolute best and also being proactive with outreach, calling past veterans and families that we've interacted with are just a couple of best practices. And as Dana mentioned, there were silver lining on the training and outreach front for our partners. Using our military culture training before COVID, that was exclusively in person. And due to COVID, we shifted to a virtual and, you know, tripled our coverage with community services providers being able to engage in that military culture training. We've also been able to go virtual with our peer support groups and have stood up a statewide, because you can reach the whole state instantly, women veteran peer support group. And a shout out to our women veteran program manager, Bev, who's been very active in this event. She's also hosting lots of wellness events for women veterans virtually outside of business hours. So it showed us that we can still reach the SMVF community and more creatively.
Awesome. Thank you both for that. One of the questions that we had that came through the chat was, many of our veterans don't have access to things like mobile phones or laptops or maybe computer illiterate, particularly in our rural areas. So Brandy and Dana, can you talk to us a little bit about, you know, COVID-19 and what are some of your strategies that you're using, you know, for helping individuals that are having challenges in that space? And is there things that organizations can use to support these groups?
One initiative that I want to highlight that is not managed within our department, but is managed by Maryland's Behavioral Health Administration, Maryland's Commitment to Veterans, is their Operation Roll Call. initiative where veterans can call the Maryland's Commitment to Veterans hotline, and I can put that in the chat when I finish my comment. And veterans can request calls from the resource coordinators, check-in calls on a regular basis, similarly to what the Maryland Department of Aging launched months ago, but this is specific to the veteran community. And it just affords that the opportunity for our Maryland's Commitment to Veterans coordinators to make that connection with our veterans, to do a check-in, to see if they are in need of any particular resources, if they need assistance with anything specific, and that is via phone. So that's kind of like going, you know, old school with utilizing the phone that so many of us don't even have anymore. But it's extremely important for us to be mindful of the diversity within our veteran population, and not all of them have access to internet and do not have computers in the home. So the launch of Operation Roll Call, I think, has been phenomenal. And I think from my perspective within MDVA, what we have tried to do is to drill as close as we possibly can down to the grassroots level and inform our local health departments or our local veterans commissions of what is going on, what offices within MDVA are currently still seeing customers. Because we are, you know, we're kind of operating up here. So the more we can drill down and inform our community providers who are having still that face-to-face connection, or making those phone calls, or receiving phone calls, perhaps they're in an intake capacity. If we can get our information into their hands, we hope that they can then inform our veterans of kind of what's going on and can work to connect them as necessary. And I'll put the number for MCV in the chat right now.
Yeah, just to follow up, that old school phone outreach has renewed life, and we were calling those connection calls. And what we find is that when we reach out proactively, that veterans and families may not realize that they had needs, but we open that dialogue so that we can get them connected. And through the Virginia Department of Veterans Services, we're also making sure that through the Governor's Challenge process and other regional work groups, such as our VA Medical Center, regional outreach work groups, and the Suicide Prevention Coalition's constantly communicating all of our different access information. What does it look like now? How do you best facilitate a referral? Just staying in that constant communication, and that the Governor's Challenge process has really offered a platform for that.
Thank you, Dana and Brandy. We're right at the end, so I'm going to squeeze in one last question before we close today's program. And that's, which programs do you think need more support in your community? What help can we all give on the call to what you are doing? Dana?
Oh gosh. I would say, helping support us in spreading the message of the work that we are doing. Like I mentioned, my outreach program within MDVA, it's just me and a deputy director. So, the more we can get out and inform on what MDVA has to offer, what the health department has to offer, and drive that down to the community. And we don't just want to educate the community, we want our community providers to then be translating that information to our veteran community. Because that's really, I believe, where the greatest change is effective. It's at that grassroots level. So the more closely we can work together with our community partners, and really, we've tried very hard to think outside of the box. As I mentioned, our libraries are incredible partners, trying to inform our homeless providers, just really trying to get our message into the local community. I think that's probably the best way that our nonprofit community, our local community providers, our local our counties, Baltimore City, can help us.
And I'll echo that message. We obviously, Dana and I have a special interest in state departments of veteran services and affairs, but we cannot understate the value of this function within our states, because, you know, our teams make it our job to know what's available at the federal, state, and local level, and using platforms like this with EveryMind and our Serving Together partners to enhance connectivity. I think Senator Kaine said it really well earlier in his comments. He said, we want to create and enhance a network of support so that no one feels alone when they have needs. The resources are there by and large part. It's just making sure that the right families know about them when they need them, no matter what service they're trying to access. So if all of our partners ask about military connection and then promote the State Department of Veteran Services and Affairs, we go a long way to get there. It's not the be all end all, because we need all of our partners at the federal, state, and local level, but it is a great starting point. So with that, I really appreciate everyone's time and this opportunity. Christy and Amsi, thank you so much.
Awesome. Thank you, Dana and Brandy, for joining us to share more about the progress being made in our communities. I also just want to say thank you to EveryMind's development team, Amsa Heck, Shalini Stone, Tara Latimer, and of course, our AmeriCorps fellow, Janae Tyler, who made this event possible today. Thank you to our support from Montgomery County Hotline that helps to provide a critical support to veterans, especially to Pika Chung and Rachel Larkin. We appreciate you all for joining us today to discuss this important priority we as a community need to collectively work together to solve. As a reminder, we'll hope you'll partner with us to promote legislation like U.S. Senate Bill 785 and others, and help us to be an ambassador for this cause. We hope you have a wonderful week, and we look forward to connecting with you all further. Thank you so much.